Good evening. For the first time, there are more new cases of coronavirus being reported outside China than within. Dozens of countries are now affected, with several, including Brazil and Pakistan, confirming their first cases today, and Germany declaring it's on the verge of an epidemic. Italy, the main focus of the infection in Europe, has tonight reported a surge in cases. Here, Public Health England says tests for coronavirus are being stepped up to get a better picture of whether the virus is spreading. So far, just over 7,000 people in the UK have been tested for the virus. 13 have been positive. 8 of them have already recovered and have been discharged from hospital. Our medical correspondent Fergus Walsh reports now on how, despite the relatively small number of cases, coronavirus is having an impact here.
The coronavirus is impacting thousands of lives in the UK, even though there's no outbreak here. More schools sent children home following half-term trips to Italy. At Canary Wharf, several firms asked staff to work from home after one employee who'd been to Italy reported flu-like symptoms.
The public can be assured that we have a clear plan to contain, delay, research and mitigate, and that we're working methodologically through each step to keep the public safe.
None of us has any immunity to this new virus, but even if we get a widespread outbreak in the UK, analysis from China suggests that 81% of those infected only get a mild illness and so don't need medical treatment. The first symptoms are a fever and dry cough. Older people and those with existing health problems are at greater risk from the coronavirus, which attacks the lungs. But that also applies to seasonal flu, which kills thousands of people here every year.
The one and only Diamond Dave, live from hospital in Japan.
Some good news for Britain's David and Sally Abel, who were on the cruise ship Diamond Princess, docked in Yokohama. They're nearly recovered after getting coronavirus and pneumonia.
Even though they were talking 2 days ago about putting me on a respirator, thank God that has not been needed, because I've been gaining strength on a daily basis, really have.
Northern Italy has a serious coronavirus outbreak, the biggest by far in Europe. Virtually all traffic is banned from entering 11 towns designated red zones. More than 50,000 people have been in quarantine since Sunday. But the virus hasn't been contained. The first confirmed cases in Brazil and Algeria, as well as Austria and Switzerland, were all linked to Italy. And France recorded its second death at a Paris hospital, a 60-year-old teacher who had no record of travel to any outbreak hotspot. Germany is bracing itself for a surge in cases after a couple with coronavirus symptoms spent 10 days travelling before they were diagnosed. Both are now in hospital.
Wir befinden uns am Beginn einer Corona-Epidemie.
We are at the beginning of a corona epidemic in Germany. The chain of infection is no longer completely traceable.
Remarkably, China is now reporting fewer new cases than the rest of the world. This is Wuhan, the city where the virus emerged in December. For a time, its health service was overwhelmed. But now patients are starting to go home, while other countries wonder, will it be their turn next? Fergus Walsh, BBC News.
Well, hundreds of holidaymakers in Tenerife, including more than 160 from the UK, will have to stay in isolation in their hotel until March the 10th, after 4 guests from Italy tested positive for the virus. This evening, the Foreign Office said it's been in contact with over 100 of them, offering advice and support. Well, our correspondent Dan Johnson is there for us now. Dan.
Yes, the situation got much more serious here today. Not just the 4 cases confirmed here, but tonight reports of another case on one of the other islands in the Canaries. And there are hundreds of guests here who are waiting to find out what the authorities think the best thing is for them. There are fears that this hotel could become a landlocked version of that cruise ship in Japan. And tonight, the Foreign Office, the consulate here, has been delivering letters to travellers because people say information has been either inconsistent or non-existent. At least there are some people here getting updates. We saw staff being briefed in the hotel car park this afternoon, presumably being told to prepare for the long haul. On the balconies above, guests have been left unsure what's happening and how long their stay could last. Hi Rosie, this is Dan from BBC News. Rosie and family should have gone home on Sunday, but a sandstorm delayed their flight. Now they face a fortnight in quarantine.
The health officials around lunchtime said that everybody or most of the people in the hotel would be quarantined for 2 weeks. Have you not heard that?
No, we've seen that in some places, but the hotel haven't said that at all. We're fine. We're happy to quarantine ourselves at home, but 2 weeks in our rooms would just not be okay.
Away from the balconies and behind the masks, some are carrying on. But unease is spreading alongside confusion, anger and cries for help.
Come on, please, Foreign Office. We are here. We have not got it. We've been tested. We haven't got it. Bring us home, because what will happen is that if we do get it, it falls upon your hands. We are more at risk here.
The hotel was put on lockdown yesterday morning after a doctor on holiday from Italy tested positive for the virus. His wife and 2 others in their group of 10 are also infected. They're being treated on the island.
The rest of the people from the group tested negative, besides those 4 confirmed cases. That's good news because it means the virus was probably kept amongst those in close contact.
But the news is not so good for those still stuck. Tonight, the Foreign Office said it is in touch with British tourists here, but how they get home, when, and what awaits them on their return still isn't clear. Dan Johnson, BBC News in Tenerife.
Well, we can speak now to our sports editor Dan Rowan, who's in Dublin for us, where they announced that the Six Nations matches between Ireland and Italy have been postponed. Dan.
Well, the Irish government believes that the match here at the Aviva Stadium in Dublin in 10 days' time constitutes too great a public health risk. That's because Italy is the worst affected European country as a result of the outbreak, of course, and also around 2,500 Italian fans are expected here for that Six Nations match. So it's been called off. The Irish Rugby Football Union are trying to find an alternative date. That won't be easy, though, in what is already a crowded rugby calendar. And the impact may not stop there in rugby terms, because the RFU, I can tell you, this evening are in talks with the Sports Minister about whether or not England's match against Italy in the final round of Six Nations matches should take place in Rome. So the tournament really could be thrown into a degree of disarray. And it goes beyond that to other sports too. In football, there's been league matches cancelled in Italy. England are due to host Italy at Wembley next month. The Euros, of course, 4 games are due to take place this summer in Rome. And then in other sports, the Cheltenham Festival, F1 races, the Chinese Grand Prix has been cancelled. And of course, the major concern is around the Tokyo Games. Yesterday, an IOC member said that a decision on that may not be made until May. It would be unprecedented in peacetime if the Olympics were called off, and the damage, the impact it would do to athletes, broadcasters, organisers would be hard to quantify. But at the moment, organisers insist it's business as usual.
Dan, many thanks. Well, our global health correspondent Tulip Mazunda is with me. And Tulip, there's a real sense now that this is spreading across Europe.
Yes, well, things are moving very quickly in Europe. Germany, as we've heard, now says it's at the start of an epidemic, and many people, it would seem, have come into contact with these 5 new cases before they were identified as being as having the virus, and that could really change the picture in Germany. The fact also that there have been this sharp rise in cases in Italy over the last 24 hours, 400 cases there is a major concern, as is the fact that cases have been exported from Italy to a number of other European countries. What we're probably going to start seeing a little bit more of at airports in European cities is people being screened more, people being getting health checks and being told, given crucial information really on what to do if they do become ill.
OK, Tulip, many thanks.